Is it a cold, flu, or walking pneumonia? Spot the signs, stay safe, and breathe easy. Have you ever had a cough that just wouldn't go away? Maybe you brushed it off as a lingering cold or the flu. But what if it's something more? Walking pneumonia is a sneaky illness that often masquerades as a simple cold or mild flu. Many people don't even realize they have it because the symptoms can be so subtle. Let's dive into what walking pneumonia really is, how to differentiate it from a cold or flu, and most importantly, how to protect yourself. 1. What is walking pneumonia, and why is it a concern? Walking pneumonia, also known as atypical pneumonia, is a milder form of pneumonia caused by bacteria like Mycoplasma pneumonia. Unlike traditional pneumonia, which can knock you off your feet, walking pneumonia typically allows you to continue your daily routine, hence the term walking. But don't let the name fool you. While it may seem less severe, walking pneumonia can still cause complications if left untreated. Prolonged infection can weaken the lungs, leading to serious outcomes such as respiratory failure, severe bacterial pneumonia, or exacerbation of pre-existing conditions like asthma or chronic obstructive pulmonary disease, COPD. In rare cases, walking pneumonia can affect other parts of the body, such as the heart or brain, turning a seemingly mild illness into a potentially life-threatening situation. Early detection and treatment are crucial. 2. Cold, flu, or walking pneumonia. How to tell the difference? The key to identifying walking pneumonia lies in understanding the nuances of each condition. Common colds typically cause a sore throat, runny nose, sneezing, and mild fatigue. They are viral infections that generally improve within a week without severe complications. The flu, on the other hand, comes with symptoms like fever, body aches, chills, and exhaustion. It hits hard and fast, often leaving you bedridden for days. Coughing and nasal congestion may accompany these symptoms, but the severity sets it apart from a cold. Walking pneumonia, however, starts subtly. Its most common symptom is a persistent dry cough that lingers for weeks. Other signs include mild fever, fatigue, chest pain, or shortness of breath. Unlike the flu, walking pneumonia doesn't usually cause high fever or severe body aches, but the prolonged symptoms can drain your energy and disrupt daily life. 3. Recognizing the symptoms of walking pneumonia. Identifying walking pneumonia requires a closer look at your symptoms. Persistent dry cough is the hallmark sign. Unlike a cold or flu, this cough doesn't resolve quickly and often worsens at night, disrupting sleep. You might experience a low-grade fever, which is less intense than the high fever typical of the flu. Breathing deeply might cause mild chest pain or tightness, signaling inflammation in the lungs. Walking pneumonia can leave you feeling unusually tired, even after light activity. Some individuals may also feel slightly out of breath during physical exertion. If these symptoms last longer than expected or worsen over time, it's a red flag that requires medical attention. 4. Causes and risk factors. Walking pneumonia is most commonly caused by Mycoplasma pneumonia, a type of bacteria that spreads through respiratory droplets. It's contagious and can pass from person to person through coughing, sneezing, or close contact. Certain groups are more susceptible, including children and young adults, especially in crowded settings like schools. Individuals with weakened immune systems and people with chronic respiratory conditions such as asthma or COPD. 5. Prevention tips to stay healthy. There are several steps you can take to protect yourself from walking pneumonia. Practicing good hygiene is key. Wash your hands frequently with soap and water, and avoid touching your face, especially your eyes, nose, and mouth, as this is how germs spread. Staying up to date on flu and pneumococcal vaccinations reduces your overall risk of respiratory infections. Maintaining a healthy lifestyle is equally important. Eating a balanced diet rich in fruits and vegetables, exercising regularly, and getting adequate sleep can strengthen your immune system. Smoking damages the lungs and makes you more vulnerable to respiratory infections, so avoiding tobacco is a critical preventive measure. During cold and flu season, minimizing exposure to crowded environments where germs spread easily is also helpful. Finally, early medical intervention is vital. If you suspect walking pneumonia or experience persistent symptoms, seek medical attention promptly. Antibiotics can effectively treat the condition and prevent complications. 6. When to see a doctor. Knowing when to consult a doctor is essential. If you experience a cough that lasts more than 2 weeks, difficulty breathing, chest pain, or extreme fatigue, it's time to stop guessing and get evaluated. Walking pneumonia is treatable, but delayed diagnosis can lead to unnecessary complications, some of which can be life-threatening. Final thoughts. Walking pneumonia might not knock you out like the flu, but it's not something to ignore either. By understanding the symptoms and how to differentiate it from a cold or flu, you can take proactive steps to protect your health. Whether it's practicing good hygiene, getting vaccinated, or seeking medical advice when needed, small actions can make a big difference. Now that you know how to spot walking pneumonia, share this information with friends and family. Staying informed is the first step to staying healthy. If you found this information helpful and want to learn more about health tips, staying safe, and maintaining a healthy lifestyle, make sure to subscribe. By subscribing, you'll stay updated with valuable content created to keep you and your loved ones healthy and informed. See you next time!